So good morning. So I'm gonna perform an easy PAP. So first is make sure we check the patient's chart for any information. So once inside, we always introduce ourselves to the patient and then explain them the therapy, such as telling them that my name is Anthony and I'm from the respiratory care department. So this one is an easy PAP. It would help you relieve any secretions present, remove any secretions, clear up your airways, and prevent your lungs from any collapse. So with this one, make sure we also have to reassess the patient, check the patient's ID band for confirmatory purposes. So there are two ports on it. So the first port is for the pressure monitoring port, which is a disposable one, and make sure you tighten it up and inspect the device for any cracks present before we use it to the patient. The other one is for the oxygen source. So with this device, it can be used together with a nebulization treatment. So in that way, it would help restore or normalize the lung volumes to the patient. So with this, it is going to ideally set up at about 5 liters. Start the patient. Should be hold it up like this in an upright, should not be downward because of the flow of the monitoring port, and then they should not obstruct in the back. It is not ideal to obstruct the back. So with this, we usually start it up at about, let the patient do it about not more than 5 times starting to prevent any complications. And then with this, you always have to demonstrate in front of the patient for them to understand. Let the patient first take a good seal when using a mouthpiece with their tongue underneath, not blocking the mouthpiece, and then allow the patient to take a slow deep inspiration, and then let the patient take a strong exhalation but not in a forceful way. Ideally, it is ideal to let the patient reach about 3 to 4 seconds exhalation time, and then every after attempt, let the patient rest and then allow the patient to cough. When the patient would expectorate or cough, take note of the color, consistency, and amount of each sputum. And then once you use it together with a nebulization treatment, there should be a T-piece in front with its specimen or medication cup. So once everything is done, turn this one off and remove it. The monitoring port should be disposed and then should be covered. By the way, if you use the easy pop without the monitoring port, make sure this one is covered because we should not expose it to ambient air. So with this device, it should not be soaked to water, it should be air dried, and then with the mouthpiece, it should be sterilized or cleaned with sterile water. Make sure you have an option of mask just in case if the patient would not tolerate the mouthpiece. And then once everything is done, make sure we reposition the patient from upright. Make sure they're comfortable. Do your set of vital signs, pulse assessment, and then once you go outside, make sure we wash our hands, and then make sure we chart it everything what we notice to the patient if they're able to tolerate the therapy, and also make sure we include it how much the pressure the patient was able to reach with our chart. So once everything is done, communicate with the staff and we're good.